So my name is Tracey Carvin. I'm one of 4 social workers that are connected to our cancer program. I have been a social worker for over 20 years, and I've been lucky enough to be part of this cancer program for the last 12. And when this with the social work program was developed, it was developed a little differently than some other programs that you might be aware of in hospitals. A lot of social workers are very often crisis-oriented. They're looking at very practical issues for people, whether that be financial or otherwise. Our program here is a little different because we wanted it to really much focus on not only those practical issues, but also the emotional component to a cancer diagnosis, because this is quite the emotional roller coaster ride for patients and families. So it's very therapeutic in nature as well. So what I'm going to talk about today are some of the common challenges that cancer patients and family members face with a cancer diagnosis. Talk about what it is that we as social workers can do for you and how you're going to get in contact with us. So grief. Grief is a big part of what we talk about in social work with patients and families. When we think of the word grief, we often associate that with death. You know, we have Uncle Charlie died and we grieve his loss, okay? But grief is so much more than that. Grief is a very normal emotional response to loss and to change. And with a cancer diagnosis, there are a huge number of losses that you experience along the way. And it is so important that you are able to process all of those losses. Emotions that are involved: sadness, anger, depression, anxiety, frustration. These are all things that you feel and can be very overwhelming. But we're not socialized very well in general. You know, whether that be from society as a whole or whether that be through our families of origin, we're often told messages like, be strong, have a brave face, stiff upper lip. How many times have you been told to think positive? Okay, what happens when we receive these messages? We actually respond in a really negative way because we tend to think, oh, that means I can't talk about it. I have to suck it up and I have to pretend to be positive because that's what's expected of me. When we suppress our emotions, we get negative consequences, okay? So some of them are what you might think of typically like a clinical depression or anxiety, and I'm going to talk a little bit more about that in a moment. Colleen touched on one of the side effects that tends to happen, and that's that brain fog. So I'm going to talk a little bit more about that because, again, we sometimes, and I don't know whether you've heard it in your past discussed as chemo brain, but in our world it really isn't chemo brain, because as soon as you hear the word cancer and it's associated to you, you instantly get very overwhelmed. And your brain is a very protective organ, and when it recognizes when you're overwhelmed, and it almost creates a veil, okay, almost like a shock that comes over you. And your brain is going to filter the amount of information it's going to allow you to take in. So you might go to a consultation with a doctor, with myself, with anybody, and you're only going to take in maybe 30 or 40% of what's said, okay? The more you suppress emotions, the worse that brain fog is going to get, okay? You have emotions for a reason. They are the built-in coping mechanisms you're born with, and you are meant to express them, and that is how you cope, okay? So our job as social workers is to help you be able to recognize your emotions, to be able to become very comfortable with them, and to develop skills and strategies as to how to express them. Like I said before, this is an emotional roller coaster ride. You're going to have good days, you're going to have bad days. We want you to feel comfortable enough to be able to express your bad days, okay? Because when you do that, it's like dumping a bucket. You dump all that grief out, and when you make your bucket upright, it's empty, and there's room for joy, and there's room for happiness. And you can get back up to those good days that are true good days, and not just you wearing a mask and pretending. Family support. A cancer diagnosis is a family diagnosis. Anybody that is connected to you as a patient who loves you, who cares for you, is going to be affected by this. Whether that be your spouse, children, close siblings, parents, whoever it is, caregivers, okay? So often I hear from family members or caregivers, spouses, they say, it's not about me. It's not my cancer. I can't think about me. That would be selfish, right? It's all about my loved one. My response to that is, no, it is about you, because this is happening to you. And you have to, as family members and caregivers, tend to your own losses that you're sustaining along the way and tend to your own grief. Because if you don't do that, you're not going to be much good for that person that you're wanting to support, for that patient. It's just like I say being in an airplane, right? The oxygen masks come down. What do they tell you? They say to put your mask on first, take care of yourself, and then you can be a support to the people that are with you. If as family members and caregivers you don't take care of yourself, you're no good to anybody else. Okay, so our job as social workers is to work not only with patients but also with family members. Sometimes we don't even meet the patient. It depends on who needs to come in. And our job is to help those people be able to process their losses and their grief and know that self-care is really important. Communication is huge, and that's a massive part of what we do as social workers because we don't do this very well. What I tend to find is that you get patients and family members or spouses, and they start out like this, and they're connected and they're caring for each other and they're moving through life as a unit. And then there's a cancer diagnosis and everybody does this. You don't talk about it. You don't want to mention cancer. You don't want to say the wrong thing. You don't upset the person you love. God forbid you make somebody cry, right? Because nobody wants to do that, although you should. And so what this creates is a very lonely and isolating experience for everybody. This isn't where you want to be. Okay? Our job is to help people develop some very, very effective communication strategies and to come back together as a family unit. Talk about how you're feeling. Talk about the fears and concerns that you have. Express your frustrations. Because when you do that as a family, you're going to lessen the anxiety in the home. I often talk about, if you have a couple and husband and wife come down for breakfast and the wife says to the husband, honey, how are you? You don't look so good today. And he generally says, I'm fine. 80% of communication is body language. So this wife, who knows her husband's not fine, now is stepping back and going, okay, he just lied to me, so what's going on? What isn't he telling me? What's happening? And so as she's thinking, her anxiety level is increasing. His anxiety level is already up here because he hasn't talked about it. So in the guise of trying to be protective, you've made it worse. Okay? The more we talk about it, the better it's going to be for everybody. We tend to make assumptions as to what people are thinking and feeling. I hear people say, oh, we've been married 40 years. I know what my husband thinks. I can finish his sentences. I don't care if you've been married 100 years. You do not know what another person is thinking and feeling. And when we make assumptions, we get ourselves into trouble because that's where miscommunication happens. So again, we are here to help you develop some good communication strategies so you're moving forward more effectively. Depression and anxiety. We throw the word depression around like it's candy. How often have you heard, oh, I'm so depressed today? Are you really? Are you just having a bad day? Because if we're having a teary day and we're crying, that's not really depression, that's us coping. Remember, our emotions are those inbuilt coping mechanisms. Depression looks very different. When somebody is depressed, often what you see is somebody who lacks highs and lows. So there's a very flat affect. You don't feel anything. I remember a woman who came to see me who said she knew she was in trouble when her granddaughter was born and she went and saw this baby for the first time and felt nothing. Right? That's that flat affect. People withdraw from friends and family. They have a hard time getting up. They want to sleep all the time. Aren't eating properly, not tending to personal hygiene, having suicidal ideation. Those are signs of clinical depression. Expressing emotion is not. So it's really important not to confuse the two. Anxiety is very normal. We all have anxiety. I have anxiety. I don't like coming up and talking in front of people. That makes me anxious. But anxiety is only an issue when it gets to the extent where it is affecting your ability to function on a daily level. Okay? Anxiety and depression. Depression, here, 25% of people who experience a cancer diagnosis are going to have depression. It is not something you have to just live with. It is something that can be helped, it can be managed, and we can do something to allow you to function at a higher level where you are not withdrawing from friends and family, you're not struggling. Okay, so our job as social workers is to help you process your anxiety. Again, develop tools with depression as well to be able to manage that. Okay. Sexuality. This is a really, really important piece. 80% of patients that have a diagnosis of cancer are going to have some kind of a sexual health issue, whether it's functioning or whether it's intimacy with their partner. Not too many of us walk into our doctor's, our oncologist's office and say, you know, my treatment and my chemotherapy, my radiation, my surgery, I'm having effects with my sexual functioning and I'm wanting to talk about that. We don't do that well. We don't bring that up. And as healthcare providers, you know, historically, we haven't been very good at that either, and we haven't been asking the right questions. But here at this cancer center, we are endeavoring to do that differently, and we want to ask those questions. We want to help you. Just because you have a cancer diagnosis doesn't mean that your sexual life has to end. It may be different. Our job is to help you manage those differences, communicate with your partners, and be able to move forward in a very, very functional way. There are all kinds of things like Colleen talked about with regard to difficulties with sexual functioning, whether that be vaginal dryness, stenosis, which is like a narrowing and shortening of the vaginal canal, painful intercourse. There are things that we can talk about, and there are things that we can do to address those issues. Okay. So really important, we are here to talk to you, and we're here to help you get through those struggles. Return to work. For many patients, this is a big, big hurdle. What I often find is I will see a patient and patients aren't always very realistic going into treatment. And so you shouldn't be. You don't really know what you're going to be experiencing. You don't really know what the effects are going to be. So I get patients who will go see their oncologist, and they'll come home after their planning session, and then they get their calendar out, and then they start ticking off all the days that they're going to come in for treatment, and they put a big red circle around the last day of treatment. And then they think, okay, I'm finishing treatment on the 1st of November, give myself a couple of weeks, I'll go back to work on the 15th. Not very realistic, okay? You're not only recovering from your treatments physically, but you have to recover from them emotionally. So we have patients that don't go to work for maybe 3 months, 6 months, a year, 2 years. It's different for everybody. Our job as social workers is to help you not only heal emotionally, but to help you develop a realistic plan to return to work, because there is nothing worse than going back to work too soon, setting yourself up for failure, and then all of a sudden having to leave again. That can be incredibly devastating. Okay? So we are here to help you manage your return to work so that you are doing that in a way that is going to be successful. Resources. In this cancer center, everybody that you deal with here wants you to have the absolute best care you can possibly have. So our job is not only to provide that to you here within these walls, but also to make sure that you're connected in the community to the resources that you need. And whether that be financial, social, emotional, mental health, whatever resources are out there, we want to make sure that you are connected so that you are feeling that you are, you're covered no matter where you are. You're getting those supports in place, okay? Our job is to try to help you make those connections. Getting to us, that's really easy, okay? All you would have to do is contact the extension 43520, and you will be connected to our administration assistant, and her name is Kim Roberts. She's fantastic. She will book you in with one of the social workers to try to get you the soonest appointment possible. If for some reason you forget the extension, you can't remember Ken's name, don't know where we are, you can pretty much talk to anybody within this cancer center. It could be your doctor, your primary nurse, chemotherapy nurses, nurse practitioners, occupational therapists, physiotherapists, dietitians. We all know each other, and all you have to do is say, gee, you know what, I'd kind of like to go see a social worker, and they will facilitate that referral. Okay, I encourage you to come and see us if you need to. I encourage you to look at your emotional health as just as important as your physical health, and we would be more than happy to assist you.